Sepsis is a life-threatening condition that occurs when the body's immune response to infection spirals out of control, leading to widespread inflammation, tissue damage, and organ failure. Without prompt treatment, sepsis can quickly become fatal. Sepsis can be caused by various microorganisms, but the most common culprits include bacteria such as Staphylococcus aureus, Escherichia coli, and Streptococcus species, viruses including influenza and COVID-19, fungi like Candida species, especially in immunocompromised individuals. Sepsis often begins with infections in common areas including the respiratory tract, for example, pneumonia, the urinary tract like urinary tract infections, the abdominal cavity such as peritonitis, the skin and soft tissues, for instance, cellulitis. Understanding these sources helps in identifying and treating sepsis early. Early detection is critical in managing sepsis. Screening allows healthcare providers to identify the condition before it progresses to severe stages, improving outcomes and saving lives. The first step in screening for sepsis is an initial assessment. Determine if there is a likely infection. Assess the patient's NEWS, which stands for National Early Warning Score. If the NEWS is 4 or greater, or 5 or greater if the patient is on oxygen, proceed to the sepsis pathway. If the NEWS is less than 4 or less than 5 if on oxygen, assess further if the patient is immunocompromised or older. Next, screen for sepsis criteria by checking for evidence of infection and new-onset organ dysfunction. Look for systemic inflammatory response syndrome or SIRS criteria, a heart rate greater than 90 beats per minute, a respiratory rate of 20 or more breaths per minute, a temperature less than 36 degrees Celsius or greater than 38.3 degrees Celsius, and a white blood cell count less than 4 or greater than 12 times 10 to the 9th per liter. Based on these findings, if there is evidence of infection and organ dysfunction, this is sepsis. Escalate care immediately. If there is evidence of infection but no organ dysfunction, continue routine infection management and reassess if the patient deteriorates. If there is organ dysfunction without infection, rule out other causes. Time 0 marks the start of life-saving treatment. From this moment, the Sepsis 6 bundle must be implemented within 1 hour to maximize patient survival. Take 3 involves gathering critical diagnostic information. Take blood cultures to identify the cause of infection, measure lactate levels and perform essential blood tests. Monitor urine output to assess kidney function. Give 3 focuses on providing life-saving treatments. Administer intravenous antimicrobials to combat infection. Provide intravenous fluids to restore blood pressure and circulation. Supply oxygen to maintain oxygen saturation levels between 94 to 96%, or 88 to 92% for patients with chronic lung disease. After completing the Sepsis 6 bundle, follow these steps. Reassess lactate levels within 3 hours or sooner if the first reading is elevated. Continuously monitor the patient's clinical response. Escalate care to senior staff if the condition worsens. If signs of septic shock are present, such as persistent hypotension requiring vasopressors to maintain mean arterial pressure of at least 65 millimeters of mercury, escalate immediately. Consult a senior clinician or critical care specialist. Provide advanced life support as needed. Sepsis is treatable if caught early. Learn the signs, act fast, and remember, time matters. Thank you for watching, and don't forget to like, share, and subscribe for more valuable content. Stay strong, stay healthy, and stay informed.